Hi, and welcome to Florida Hospital's Health Chat. I'm Jennifer Roberts. Thank you so much for joining us. This is a once-a-month event that we have here to provide a Florida hospital expert so you can get some of your health questions answered. We have our conversations for no more than about 20 minutes over the lunch hour in hopes that you can get some medical information that you might need while you take a little break from work. Today's topic: what do you know about your thyroid? We're going to investigate the thyroid a little bit today with a very important specialist. He's our expert, Dr. Scott Magnuson. He's a head and neck surgeon at Florida Hospital Celebration Health. I've got a couple of questions that are going to get things started here today, but we hope that you're going to join in and submit yours as well. And you can do that through several ways. Just use the chat forum there on the screen, or you can also use social media as well and tweet us your question too. The doctor's in, so let's get started with Dr. Magnuson. Thanks so much for joining us today.
My pleasure, thank you.
All right, so tell me a little bit about what you do, because head and neck surgery, I mean, obviously we know it's about the head and neck, but tell me a little bit about what your specialty is and how it's different than what people might think.
Okay, well, head and neck is a small part of my bigger specialty, and that is ear, nose, and throat, so otolaryngology. So my training is a 5-year training program after medical school, where you become a general ear, nose, and throat doctor. But past that, I wanted to take care of patients with head and neck cancer, and so I focused my specialty on patients with tumors, not necessarily cancer, but tumors of the head and neck.
And you have a partner in your practice that helps you a little bit with the reconstructive, and I know that's pretty unique, so talk about that too.
Yes, so Dr. Hillary White is a partner of mine. She was a fellow where I was originally before coming here to Florida Hospital at University of Alabama, Birmingham. And her area of specialty is, in addition to the tumors that we treat of patients with head and neck tumors, her specialty is reconstruction. So in some patients, a tumor may involve the jaw or the tongue or a large part of their neck, and we have to remove that, and that leaves a large defect. And the patient needs that defect reconstructed, and so she'll take tissue from the arm or maybe from the abdomen or from the leg and even make a new jawbone if necessary. Wow. And transplant that tissue and make a new jawbone out of the bone that she takes from another part of the body.
Sounds amazing. Sounds like science fiction a little bit, but I know you guys are doing it all the time at Celebration Health, so that's pretty cool. Let's get on to the thyroid, because that's what we're talking about today.
Yes.
What is the thyroid? What does it do? A lot of people have heard of it, but may not really know anything about it.
Sure, the thyroid is a gland that's located right in this portion of the neck, right in the center in the lower portion. It's the shape of a butterfly or a bow tie maybe. There are two sides, a left and the right side. And its main purpose is that it produces hormones that regulate our body metabolism. So it can help with growth, with energy levels, tissue growth, tissue health, things like that, but mostly metabolism.
Metabolism. So all the folks that talk about, you know, I have thyroid issues and that's relating to my weight, that's kind of right on target. Do a lot of people experience that weight issue with the thyroid?
Yes, you know, people who are overweight sometimes have problems with their thyroid being underactive, hypothyroid, because it does provide a hormone that helps us keep our metabolism up, and if the hormone is too low, then our metabolism is slower, and it's hard for us to burn those calories of food that we eat, for example. And so we have a tendency then to gain weight if the thyroid is underactive. Some people have the opposite. We don't hear about these people as much, but some people have a hyperactive thyroid gland, and they can't put weight on. Some people try to gain weight, but their thyroid gland is too active, and so they have difficulty gaining weight.
And do you see a lot of those patients, do patients that have weight issues like that, do they eventually make it to you? I would think it might be a long weaving process before they figure out it's a thyroid issue.
So typically, patients with thyroid disease are first seen by their primary care physician or an endocrinologist. And those physicians will adjust their hormone levels accordingly, whether it needs to be raised or lowered, by different types of medication. And if it gets to be a point where they need to have an operation, because sometimes surgery is needed to treat the thyroid disease, then the patient is referred to us by the primary care physician or by the endocrinologist.
Right.
So typically, no, we don't see someone who has a weight problem and a thyroid disease come to see us and have us take care of that. If that happened, we would refer them to a primary care or endocrinologist.
Sure. Sure. There are a lot of issues with the thyroid and weight? Is that a common reason why you guys would go in and remove a thyroid, or are there a variety of other issues that can happen with the thyroid?
Generally, weight is not a reason to have your thyroid operated on, because that would indicate that their thyroid gland is underactive. And it's not very common to remove the thyroid gland if it's underactive, if it's hypoactive, because you can give thyroid medicine to bring the thyroid hormone levels up, and surgery would also require the patient to take thyroid medicine.
Yeah.
So in a few instances, we do operate on someone with a hypoactive thyroid gland. But typically the weight is not the reason why we would do an operation.
Yeah, yeah. What are the signs and symptoms of people that may be experiencing some kind of thyroid issue?
Well, I would like to think of thyroid disease in terms of a surgical reason into two categories. One is the gland is very large, and we call that a goiter. And so a large thyroid gland can cause compressive symptoms. So if you imagine you only have so much space in your neck, and if the gland gets to be a certain size, it's going to press on the structures that are in this portion of the neck, which happen to be the windpipe or the trachea and the esophagus. And so patients might say, I have some trouble breathing because the goiter is pushing on their trachea, or I have some trouble swallowing. If I eat some food, it feels like it gets stuck here, again, because the goiter is pushing on the esophagus. The other category of patients that we operate on are for patients with nodules in their thyroid gland, and whether it's a benign nodule or a malignant nodule, you know, we can expand on that. But their symptoms are going to be different. They might see just a lump on their neck. When they swallow, they'll see the lump moves up and down. Doesn't hurt them, doesn't cause any symptoms, doesn't cause any pain, doesn't cause any pressure. They can just see it. And then sometimes patients have no idea. They just go see their doctor, their gynecologist for women maybe, or just a general exam, or their family doctor, or if for endocrinologist for any other reason, maybe diabetes. And the doctor feels the neck and feels a lump, and the patient was unaware. So then they're evaluated further.
So when you're going to your doctor and they're feeling around on your neck, those are the things that they're looking for.
One of the things they're feeling is your thyroid gland. They're feeling to see if there's enlargement or if there's a lump on your thyroid gland.
Yeah, makes perfect sense. Is it a danger that a lot of these folks are asymptomatic, that they're not seeing this? Does it take some time to understand that this is what I might really have something going on here?
Not necessarily. Thyroid cancer would be the only thing that would be dangerous. And in general, there are different types of thyroid cancers, but in general, as a whole, thyroid cancer is a very survivable, curable type of cancer, with cure rates in the 90%.
That's great.
And so if you consider, even though you have a cancer and you didn't recognize it, am I in trouble or is that dangerous? Not necessarily. Of course, people don't want to walk around with cancer, but not necessarily dangerous because the cure rates are so good. And so the danger comes when a goiter gets too big, and then the patient slowly, the pressure, they don't notice it, and finally the pressure is so strong that it's difficult for them to breathe. That's dangerous. Or if they have a cancer that goes unrecognized and grows for quite some period of time.
What are some of the treatments that you would offer folks? Obviously surgery is something that you specialize in, but is there anything that folks should be doing to keep their thyroid healthy?
Well, it's easy to find out the health of your thyroid gland for some blood tests. You can have your thyroid hormone levels checked with a blood test, and your family doctor, endocrinologist can do those and may even do those regularly. Additionally, as a surgeon, we see people and we consider whether they need to have an operation, but other types of treatment can be radioactive iodine, and that is given by another type of physician, where the radioactive iodine might be used to shrink down a hyperactive thyroid gland, or to be used to kill a cancer. So there are different ways to treat depending on what the illness is.
Yeah. And so you talked about the different types with the node, you talked about the enlarged goiter. What are the surgical treatments that you would kind of go for in each of those different categories if that was warranted with a patient?
Sure. There are kind of there are mainly two operations that we do for the thyroid gland. One is a total thyroidectomy, remove the entire gland, and the other is a partial thyroidectomy, where we remove maybe just half of the gland. So total thyroidectomies we perform on patients who have a hyperactive thyroid gland, and medication hasn't been successful in regulating their thyroid levels. And so their doctor asks us to remove the gland because the hyperactivity is not healthy. You know, some people might think, well, I want to have a hyperactive gland, but it's not healthy to have a hyperactive gland. And so surgically we'd have to remove it. In that case, we would want to remove all of it, because if we leave a portion, that portion is still hyperactive. We also remove the entire gland for large goiters. If we leave a little bit behind, well, then that goiter is still there, partially there, or even can grow itself. And then we remove the whole gland for cancers. If a patient is known to have a cancer diagnosis, usually from a needle biopsy, then we go in and we remove the whole thyroid gland, because that's the required treatment for them to be cancer-free. The cases where we would do only a partial thyroidectomy are for situations where a patient has a nodule, and we don't know if the nodule is a malignant nodule or benign, meaning a cancer or not a cancer. We do the testing ahead of time, and it still is indeterminate. In that case, the only way to know if that nodule is a cancer is removing half of the gland and having that gland tested, and that nodule tested. And that's the case where we would remove half the gland. But most of the operations that we perform are for total thyroidectomies.
Yeah. And in the majority of cases, are you doing incisions right here at the neck, or what are the options that patients might have?
By far, the largest number of operations are performed through the neck. So most of the operations, we make an incision. It's a pretty small incision. They used to be large incisions, but over the past several years, that incision has gotten smaller because we just realize that we don't have to make a giant incision to take the gland out.
Yeah.
It's placed at the base of the neck, right in the center, and we put it in a crease. And so once the scar heals, it looks like a skin crease, and it's well camouflaged. Occasionally, there are some alternative ways to remove the thyroid gland. That is through an incision that you can place in the axilla or the armpit, and a tunnel is made over the collarbone, and then part of the gland is removed, and we use a robot to assist with that operation. You can also do the same thing through what we call a hairline or a facelift incision. An incision is made along the back of the hairline, and we make a tunnel under the skin to the thyroid gland, and again, a robot is used to assist with that operation. In Asia, they do other types of operations where they make an incision around the areola of the nipple, and they can make a tunnel, and they have telescopes in that case, not a robot, and they can insufflate or put some air, some gas inside the skin and inflate the neck area so they can remove it. It's a laparoscopic type of operation.
Wow. So lots of different options for people, I guess,
Yes.
that are out there to kind of looking for the right expert if they need to have that kind of surgery. Is there a certain population that is more prevalent to have thyroid issues?
Yes, by far women have more problems with their thyroid gland than men. It's probably around an 80% to 20% in terms of the ratio. 80, if you take 100 people, most of them are going to be women who have the thyroid disease compared to men. And it can be seen in all ages, but typically in the middle age, so 30 to 40, we see a lot of patients. And then maybe in the later years, 60 to 70, we may see some patients. But it's very common for middle-aged females to have problems with the thyroid gland.
Yeah. Is it something that people need to make sure that they ask their primary care physician about? Is this something that should be on that checklist of things that I want to make sure I'm getting tested when I get my physical for any thyroid issues, or if they're feeling anything, blood work? What would be your advice for women when they go visit their doctor? What should they talk about?
Well, everyone should have an exam with their physician once a year at least, an annual healthy physical exam, just to make sure that you're not having some underlying illness that's not recognized. For example, high blood pressure. You don't feel high blood pressure, so you should check those things. The thyroid gland as well. A healthy patient is not necessarily going to have any symptoms, and so when they go to see their physician once a year, generally a physician is going to include that as part of the total body physical exam. But sure, ask your doctor to say, are you checking my thyroid gland in this exam? Are you feeling it? Are you doing any blood tests? and let them explain yes or no or what they do to check the thyroid.
Yeah, important to do. And as far as, thyroid cancer, you were talking about thyroid issues in women. Is that the same for thyroid cancer? Are women more prevalent to have the cancerous part of the thyroid
Yes,
disease?
about 2/3 of the patients with thyroid cancer are women. So it is more common for thyroid cancer to be found in women than it is in men. Yes. We don't know why. We're not certain of the reason, if it's genetic or something, but probably. But we don't know the reason, but we do know that in cancer, about 2/3 of the cancers are found in women.
And as we kind of wrap this up, we've talked a lot about thyroid, about issues and diseases. What is the most important thing that you would want the general population to know about their thyroid? What do they need to know to make sure they're maintaining a healthy lifestyle and to try and reduce any issues that they can have the power to do on their own?
Well, the good thing about your thyroid gland is that many physicians can take care of you. Your primary care physician, an endocrinologist, they can manage your disease, whether it's a hyperactive or hypoactive thyroid gland. The other good news is that most of the illnesses relating to the thyroid gland are curable or can be managed.
Yeah.
And so it's not necessary for you to be sick. So if you are sick because of your thyroid gland, someone can help you.
Yeah.
If it does come, some advice I would have to a patient, if they do have to have surgery, a very important thing is that they see somebody who performs the operation frequently. There are side effects, potential risks of having thyroid surgery. It's not just a simple operation. And they relate to voice quality. You can have hoarseness following an operation. And it relates to, a risk could be calcium regulation in your bloodstream. Your calcium levels could drop too low, and that's dangerous. And so when you see a surgeon and you talk to the surgeon about thyroidectomy, it's important not only to say how often do you see risks in your patients, but how many times do you do this operation? You want to see somebody who does this even several times a week. Maybe not someone who does the operation 5 or 10 times a year. And like anything, even changing brakes in a car, someone who does it frequently is going to be better at it than someone who does it rarely.
And it's so important to ask those really hard questions. Sometimes people have a hard time asking those questions, but it's great advice. Dr. Magnuson, I learned more about the thyroid in the last 20 minutes than I've learned in my whole life, so thank you so much for your expertise on that. And that's all the time we have for today's Florida Hospital Health Chat. Of course, I want to thank Dr. Magnuson for his expertise on the thyroid. If you would like to make an appointment to see Dr. Magnuson, you can do so by a phone call, really easy to remember, 407-303-DOCS. You can also learn more about head and neck issues. You can also contact and make that appointment with Dr. Magnuson's office directly by going to celebrationheadandneck.com. Again, that's celebrationheadandneck.com to make an appointment. Thanks so much for watching our chat today, and you can find out more about upcoming web chats by liking Florida Hospital on Facebook. We'll be sure and give you several updates on the next topic and when it's going to be on. Thanks so much for joining us, and we'll hope you'll stop back again soon.